Philippine Information Agency, Kapihan na Zamboanga. Sharing with you timely, accurate, and relevant information regarding government programs, projects, and activities. Catch us every Thursday at 4 p.m. on e-media.
Buenos dias, Zamboanga! Welcome sa PIA Kapihan na Zamboanga sa SM City Mindpro. Hatid sa inyo ng Philippine Information Agency, Mindanao Communicators Network, SM City Mindpro, MCTV, and e-media. We are live at PIA Western Mindanao Facebook page and other government agencies' Facebook pages. We are also live at PRO9, the Northern News Flash, 1TV Philippines, Isa TV Channel 17, PCH Cable TV, and via cable televisions here in Zamboanga City at MCTV and e-media. Welcome po sa lahat ng ating manonood. Ang Kapihan na Zamboanga will discuss important topics that will help you make more informed decisions wherever you are. At ngayon po sa ating episode, kung para po sa kaalaman ng karamihan po ng lahat, ang buwan ng July rin po ay ginugunitan natin yung ating Nutrition Month. Kaya makakasama natin ngayon sa ating episode from the Department of Health in Region 9, we have Ma'am Cristal Intal de la Serna, their nutritionist, dietitian 4 of DOH Region 9. Welcome po sa ating program.
Magandang araw po, Ma'am Myra, and magandang araw po sa ating mga televiewers and listeners sa Kapihan. And maraming salamat po sa pag-invite again dito sa amin on the Nutrition Month celebration.
Ayun. So we are very excited to talk about nutrition ngayong araw. Lalong-lalo na po, isa rin to sa mga mahalaga na dapat nating tutukan. Hindi lamang po dito sa ating region pero po sa buong bansa natin. And with the celebration of our Nutrition Month, as we celebrate it this July, what is the core message po ng Department of Health that aims po to convey to Zamboangueños this year, and why is this observant po so vital sa ating city and sa ating well-being po dito sa ating region?
Maraming salamat, Ma'am Myra. The Department of Health, a core message for the Zamboangueños, and to all Filipinos po, is anchored on the Philippine Plan of Action for Nutrition or PPAN. So our main goal po is significantly to reduce malnutrition and hunger. So gusto po nating mabawasan ang malnutrition po at hunger, kagutuman po dito sa atin sa Pilipinas. The PPAN po is our national roadmap to better nutrition. It emphasize the importance of multi-sectoral and collaborative efforts to ensure adequate nutrition for all. So, with this year's Nutrition Month theme, yung team po natin, tema for this year is Food and Nutrition Security, maging priority, sapat na pagkain, karapatan natin. So, ang adhikain po natin ay ipaalala na ang masustansyang pagkain po ay hindi lang isang pribilehiyo or privilege, kundi isang pangunahing pangangailangan po na dapat abot kaya at makuha po ng bawat Pilipino. In short po, that the campaign stresses the urgent call to action, ensuring that all Filipinos have the access to safe, sufficient, and nutritious food, because healthy diet is a basic necessity and that should be available for every Filipino families.
Ayun. So yun talaga yung goal natin and objective natin. Bakit every year and during the month of July, we are observing or we are celebrating atong national nutrition? Kasi nga para din ito sa lahat po ng ating, lalong-lalo na po sa mga bata, sa ating children, na maiwasan po natin yung na-mention ni Ma'am Cristal, yung ating, maiwasan natin yung malnutrition. At yun, ma-improve pa natin talaga yung ating mga nutrition, hindi lang sa mga bata hanggang po sa pagtanda nila, sa mga babies natin. So, Ma'am, from the DOH perspective naman po, what is the current nutritional status natin here in Zamboanga City, particularly po among children and vulnerable groups natin? Are we seeing more cases po of undernutrition or overnutrition?
Thank you, Ma'am Milo. The local nutrition data that we are currently have po is sourced from the National Nutrition Council, Operation Timbang Plus or the OPT Plus. So based on the 2024 OPT result, Zamboanga City ranks number 2 among the cities in the region with high prevalence of stunting, wasting, underweight, and also overweight among under 5 children. Among provinces naman po, Ang Zamboanga del Sur, no, ranked number 1 at 11.37% stunting, 6.54% of underweight, wasting at 3.4%, and also concern natin yung overweight at 2.89%. With the trends on the OPT Plus, nakikita naman natin yung progress in reducing the undernutrition. Stunting has declined from 9.0 in 2020 to 5.2% in 2024, showing a significant improvement in addressing chronic malnutrition. Underweight and wasting have also steadily decreased, indicating effective management of acute malnutrition for children under 5. And ito po, minomonitor din po natin yung overnutrition, which peaked slightly in 2022 by 2.2% but dropped to 1.35% in 2024. Although the level remains lower than undernutrition rates, this trend underscore early onset of lifestyle-related nutrition issues. So, we have the FNRI, DOST FNRI National Nutrition Survey. No, the Zamboanga City has made notable improvement in reducing stunting prevalence among children under 5, and the region has declined from 35.6% in 2021 to 31.9% in 2023. So 2023 po yung pinaka-latest na data po natin. So despite of the positive trend, Zamboanga Peninsula still faces a significant challenges as it ranked among the region with the highest prevalence of stunting in the country. Kumbaga, top 3 po tayo na region na may mataas na prevalence po ng stunting. So this indicates that we need to sustain and intensify the efforts on our crucial work po, no, to further improve the nutritional status of our young children in the region.
Ma'am, based from the data po you shared, no, yung Philippines po, including Zamboanga City, faces what's known as the triple burden of malnutrition natin, including the undernutrition, overnutrition, and micronutrient deficiency. So can you explain po what this means for ordinary Zamboangueños and how it impacts po their daily lives?
The triple burden of malnutrition is a complex health and nutrition challenges. It means that people are simultaneously facing 3 different nutrition-related problems. So yung triple burden of malnutrition is characterized by undernutrition, overnutrition, and even the micronutrient deficiency manifests from either an individual lack or excess consumption of a certain set of nutrients. So kulang o sobrang pagkain, no? Or nutrient. So kung hihimayin po natin, what are the triple burden means? Yung isa, underweight, can be wasting, underweight, isa undernutrition, it can be wasting, underweight, and stunting. So yung wasting po is defined as low weight for height. Kumbaga kulang yung timbang niya ayon sa kanyang taas, and often as a result of severe sudden weight loss. Ang underweight naman po, on the other hand, it is a condition resulting from having low weight for age. Kumbaga, kulang po ang kanyang timbang ayon sa kanyang edad, no? A similar indicator of malnutrition associated with food insecurity is stunting, which is defined as having low height for weight or being too short relative to age. So yung stunting po, or mas kilala po natin sa Tagalog po, pandak or pagkabansot, or po sa Bisaya, putot, no? It is a result from chronic and recurrent undernutrition which preventing children from reaching their full potential and cognition, no? So in contrast to wasting and stunting, another form of malnutrition is overnutrition. Yung overnutrition can be overweight or obesity. So common yan sa mga bata ngayon, sa mga adult, sa mga matatanda, no? It is a condition characterized by excessive fat deposit directly from an excessive food intake or calories. So sobra naman. So ito naman, another form of malnutrition, this is perhaps the most invisible burden or tinatawag nating hidden hunger, known as micronutrient deficiency. So it refers to lack of essential vitamins and minerals tulad po ng iron, iodine, and vitamin A in the diet. For example po sa mga buntis, no, they can experience anemia, no, kulang po sila sa iron or iron deficiency. Then for children naman, poor concentration in school due to iodine or even po yung vitamin A deficiency. In essence po, no, ang isang tao ay pwede pong maging stunted, at the same time pwede rin siya maging overweight or magkaroon po ng micronutrient deficiency. So the triple burden of malnutrition can be in a single household, can be in the community where children might be stunted or underweight. Yung mga bata, ang mga anak nila can be stunted or underweight, o yung mga parents nila might be an overweight, no? Or suffering from hidden deficiency all at the same time. Yun po yung triple burden of malnutrition.
Thank you, ma'am, no, for para himay-himay nyo po talaga, no, kung ano ba yung ating triple burden of malnutrition para malaman natin yung differences nila. And with that po, paano po yung mga primary programs naman ni Department of Health or yung mga initiatives natin that are currently being implemented po in Zamboanga City or in the region to address nga itong nutritional challenges natin, especially for pregnant women, yung mga nabanggit natin kanina, yung mga vulnerable, no, pregnant women, infants, and yung ating young children.
So the Department of Health implements an integrated nutrition-specific and sensitive programs, an initiative to address nutritional challenges. As mentioned, we are targeting pregnant women, infants, and young children as part of the PPAN framework. So ito po yung focus po natin. One of these is the first 1,000 days and maternal nutrition program. So focus po tayo sa first 1,000 days from pregnancy until childbirth, hanggang umabot po yung bata ng 2 taon, no? It also include the micronutrient supplementation. We want to ensure that pregnant women receive quality antenatal care, including provision of iron with folic acid supplements and nutrition screening, at the same time counseling in early pregnancy. As well, this is also part of the implementation po natin ng kalusugan at nutrisyon ng magnanay law or RA 11148, no? Integrating maternal, neonatal, and child nutrition into local health plans. So dapat itong kalusugan ng nutrisyon at ng magnanay act or law, dapat naka-integrate na yan sa plano ng mga local government unit, no? Another, we have the infant and young child feeding program. So ito po yung promotion natin ng breastfeeding initiation or yung unang yakap at birth, then exclusive breastfeeding 0 to 6 months, and appropriate complementary feeding for 6 months and to 23 months. So we advocate to create supportive environments such as establishing mother-baby friendly sa ating mga health facility and birthing clinics. Meron din po tayong lactation rooms sa ating mga workplaces. So hopefully dito sa mga malls, meron po tayong breastfeeding room na ina-advocate natin. And another, the Philippine Integrated Management of Acute Malnutrition or the PMAM. So the management of severe and moderate acute malnutrition integrates in a routine health and nutrition services across all health facilities, no? These ensure that screening and treatment are part of the regular child health checkups. So in addition po, meron po tayong bago, yung PhilHealth na-introduce na initiative to support the management of severe acute malnutrition for children, no? Yung PhilHealth Circular Number 2024-0017, the OTC or the Outpatient Therapeutic Care Benefit Package for severe acute malnutrition for children 60 months old and below. So it aims to enhance access to outpatient care for children under 5 years of age suffering from severe acute malnutrition. Itong benefit package po natin provides financial support for the outpatient therapeutic care services worth 7,500 to 17,000 per child. So yan po yung kanang part ng PhilHealth. So yun po.
Na-mention din natin, ma'am, no, yung mga support po na pwedeng maibigay ng ating mga local government units, yung ating mga barangay. So how crucial po yung role ng ating mga local health centers and barangay health workers in delivering nutrition services natin? And how can Zamboangueños best utilize po yung itong mga resources in the communities?
Alam niyo po, Ma'am May, no, sila po kasi yung nasa ground. And ang laki po talaga ng ang pasasalamat po natin sa ating local health workers po, especially our barangay health workers, in delivering nutrition services through our community, no? So, isa sa mga vital role of our health centers, the primary access point for nutrition services, this is the local health centers. Kumbaga sila po yung first stop for growth monitoring. So sila dyan po nagkakaroon ng screening ng weight and height ng ating mga bata. Dyan din po yung distribution ng vitamin A and even sa ating mga bata, sa postpartum, and even po sa iron with folic acid and micronutrient supplementation. Sa health center din, nangyayari po yung distribution of deworming and immunization. So, nutrition counseling also happen in the health center as well as meron pong mga referrals for mga severe malnutrition. And they also implement like yung IYCF program na na-mention ko earlier, the PMAM, and the First 1,000 Days Initiative. Sa ating mga barangay health workers and barangay health workers, in general, community health workers, including the barangay nutrition scholar, which is our trusted advocates, no? Sila yung nasa community, sila po yung nagpa-promote ng mga nutrition advocacies, including po yung exclusive breastfeeding, educating families on healthy eating, mobilizing participation in feeding programs, sila din po yun. Then, health campaigns, and also yung growth monitoring sa ating mga kabataan. Sila rin po ang mga community health workers po din ang unang nakakahanap sa ating mga malnourished na bata, no, sa ground. As well as, ini-intensify din po natin sa ating mga health workers ang pag-monitor and early intervention. So they track and follow up our pregnant women, infants, young children to ensure early detection of malnutrition or health risks. Yan.
So very important po talaga, no, yung ating mga local health centers natin, no, in yun, pag-support sa ating mga nutrition programs natin, lalong-lalo na po sa ating mga barangay levels, no. With rising, ito po kadalasang problema talaga natin, with the rising food prices, many families po struggle to provide nutritious meals. So what practical budget-friendly po na tips po nang mabibigay sa atin ng Department of Health so that we can offer to the Zamboangueños or mga residents natin in Zampen, to the families po, to ensure that they are still eating healthy?
Tama po yan, Ma'am Myra, no? Ramdam po natin ang pagtaas po ng mga food prices po, no, dito sa Zamboanga City and even po sa ibang rehiyon. But the Department of Health and with the National Nutrition Council promotes several budget-friendly or practical strategy to help families eat healthy without spending more. So sa isa po ang pagpa-follow po natin ng Pinggang Pinoy guide, no? So hopefully po you are aware kung ano po yung Pinggang Pinoy para sa inyo kasi it depends on according to age. Meron pong Pinggang Pinoy para sa mga bata, sa adolescent, sa adult. So depende po. It is a visual food plate guide developed by the National Nutrition Council, DOH, and FNRI, no, DOST, to ensure balanced meal even at tight budget. So kung titingnan nyo po yung Pinggang Pinoy, kalahati po ng plato or half of the plate are vegetable and fruits, and 1/4 po yung rice. So 1/4 lang po yung rice, no, which is source of energy rich food. Then 1/4 din po ng plato is protein source. Yung ulam po natin like fish, egg, and other like chicken, meat, yan. So even if meat is expensive, you can substitute with other source of protein like munggo. Alam talaga ni Ma'am Myra, no? So paano i-balance yung diet? Pwedeng yung source of protein, pwedeng itlog or sardinas, which is mura naman and available sa atin dito sa Zamboanga City. And another strategy, we can start a simple backyard or container garden. So ito yung pinupush din natin ngayon, yung we promote the gulayan sa tahanan or faith gardens, food always in the home, to grow vegetable at home even in small spaces. So hindi na kailangan ngayon ng malaking spaces para magtanim, no? Para magkaroon po ng backyard gardening. We use container or pwede tayong magtanim ng kangkong, kamote, alugbati, or any vegetable, no? Especially yung mga green leafy vegetable and high nutrient dense na food. Another po, we want to minimize yung mga junk foods and sugary drinks. So, pasintabi na lang po, no? Pero ito pa rin po yung intensify po natin, no? We want to minimize junk foods and sugary drinks. So, tulad po ng soft drinks, chips, instant noodles, may seem cheap but offer little or no nutrient value and increase long-term health risks. So pwede nating i-replace like yung instead of yung snack natin na mga soft drinks, pwedeng fruit juices, pwedeng meron na ngayong kamote juice eh. And other po, like we can also buy local or seasonal na fruit and vegetable. And mas mura po siya and more nutritious. And we will also, ito another intervention po natin, no? We want to involve our children in food preparation. So gusto po natin na bata pa lang sila, they are aware what are the nutritious food, they are aware of pinggang Pinoy, and we want to value food and encourage them to eat vegetable. And in general, sa barangay po, kung pwede pong sama-sama natin together with our community, no, to increase our awareness for healthy lifestyle. So healthy eating doesn't have to be expensive. With the right knowledge, homegrown options, and local health support, families can eat well, grow strong, and save money. Yan ang gusto ng mga nanay, save money even during times of inflation.
Maraming salamat po Ma'am Crystal, no, for sharing this with us. I'm sure sa mga mommies natin na nanonood, at least man lang may idea sila, no, kung paano ba makapagtipid or paano ba talaga yung right way to prepare a nutritious food, lalong-lalo na po para sa mga bata. And next ko po na question is, ito para sa ating mga estudyante talaga, sa mga kids natin. Kasi yung ating food safety. So what are the DOH efforts po to ensure the safety of food consumed of the children dito sa Zamboanga Peninsula or Zamboanga City, particularly po sa mga street vendors, mga public markets, and what should consumers look out for?
Tama ngayon, Ma'am Mayno, kasi pasukan na naman. So, yung mga bata, accessible ang ating mga street foods, no? So the Department of Health, in partnership and in coordination with the local government unit po, have several strategic action underway to ensure food safety in public markets and among street vendors. Especially po yung mga yung mga malapit sa schools, no? And one of tinitignan po natin at gusto po nating i-regulate or i-implement po yung framework and inspection, yung Food Safety Act of 2013 RA 10611 and its IRR set nationwide standards from hygiene to food handling and packaging. So yan, gusto po nating ma-regulate and yung Food Safety Act. Second, we want to yung food safety training for vendors. So dapat po ang ating mga vendors meron pong they are trained on food safety, no? This focus on sanitation, hand hygiene, even pest control, cleaning utensils, safe storage practices, responding to gaps identified with the the recent studies po. And also sa Zamboangueño po, no, sa ating public market safety, sa ating mga Zamboangueño na nanonood ngayon, no, we can buy from our licensed stalls. Yung may mga trained, may mga lisensya po na mga stalls po natin with proper permit displayed. No, makikita naman yan natin sa mga tindahan ngayon. We can check the freshness indicators po natin. For example, yung fish, kung clear ba yung ice, yung mga vegetable, kung firm po ba. So we want to ensure also proper refrigeration of our meat and dairy products. Also, bantayan din po natin yung cleanliness po ng store, no, or the stalls, and choose vendors with good hygiene practices. Yan. So food safety is a joint effort, hindi lang kaya ng Department of Health, but this is implementation by the local government unit, set standards and enforce them. Vendors learn to follow safe practices and consumers stay alert and informed. So together we can ensure that street and our market foods are not only delicious but truly safe for every Zamboangueños.
Okay. So speaking po ma'am of the food safety, sa water safety naman po tayo. So how does the DOH po advise regarding the safe drinking water sources po natin and practices po here in Zamboanga? And how does this relate to the overall nutrition? Mahalaga rin po ba talaga yung water?
Yes, mahalaga. Hydration is very critical. Ngayon pa na mainit po, no? Especially in Zamboanga City, no? Warm and humid climate po, no? The Department of Health strongly emphasized the safe drinking water, and it's not only essential for hydration but also a key pillar of nutrition and disease prevention. So, yung tips po natin, no? You want to encourage to drink at least 8 to 10 glasses of clean water daily, more in extreme heat or during physical activity. So the more na meron kang physical activity or exercise, dapat increase din natin yung intake natin ng water. So sa mga bata natin, we want to ensure children or kids and even yung elderly, pregnant women stay hydrated and get water from trusted source po natin. So usually, meron tayong bumibili na lang tayo ng mga ng drinking water ngayon, no? So we ensure na license sila and sealed, no? Yes, sealed. Yun. So don't wait for illness, no? Be proactive in checking water safety at home and in the community.
Okay, so ma'am, eto naman, pag every natural disasters po natin, paano po natin na-ensure ng DOH yung nutrition and health services ng ating mga affected families, lalo na yung mga pumupunta muna sa mga evacuation centers. So paano natin po sila na bibigyan ng nutritional considerations during and after such events po ng disasters?
Ngayon, mamay, nakikita natin kahit merong disaster, nutrition is very important, no? When we face the natural disaster like typhoons, floods, and earthquake po, no, the Department of Health ensure that nutrition and health services remain accessible and responsive for affected families through a coordinated life-saving approach. So activated po nga ating nutrition cluster. So the DOH leads the Disaster Risk Reduction Management for Health or DREAM-H framework, and we have close coordination with our local government units, the National Nutrition Council, DSWD, DepEd, and other NGOs po. We want to ensure immediate delivery of services and relief. Following po the rapid nutrition assessment, nagkakandak po tayo ng rapid nutrition assessment as in place po yung ating mga programa like the micronutrient supplementation, feeding programs, protection of infant and young child feeding. So kahit may disaster, ina-advocate pa rin namin yung exclusive breastfeeding, complementary feeding sa ating evacuation centers, no? As well as wag kaligtaan yung wash or water sanitation and hygiene intervention po natin. So in disaster management, the department has strong emphasis of resilience. So this means going beyond just responding to emergency and instead building the capacity of every individuals, communities, and the health system to cope, adapt, and recover the impacts of various hazards.
Ma'am, you mentioned about breastfeeding, no? Continuous talaga yung breastfeeding even during and after disasters. So what are yung efforts pa po natin? Na-mention nyo na rin kanina how important breastfeeding, no, sa pag-develop, no, ng ating mga children para sure po yung kanilang nutrisyon. So yung efforts po natin in promoting yung ating breastfeeding and proper complementary feeding for infants and young children.
Nakikita natin ang kahalaga ng breastfeeding kasi yung breast milk o yung gatas ng ina po ay hindi natin mapapalitan at hindi po siya nabibili actually. Ito'y libre, no? We intensify breastfeeding promotion, support, and awareness, including yung mga enabling mother-baby friendly breastfeeding policies po natin, adopting yung Breastfeeding Promotion Act, no? So, gusto natin yung mga establishment, meron pong mga lactation room, ang ating mga health facilities, they are initiating breastfeeding, unang yakap, promoting as well the exclusive breastfeeding and complementary feeding. Sa atin sa LGU po, no, we want ang ating mga LGUs to adopt, no, kung magkaroon po sila ng mga local ordinances to promote grooming-in practices in health facilities and support breastfeeding mothers in workplaces. Sana po meron po yan, no, sa ating mga LGUs, and ensuring that continuity of exclusive breastfeeding even po sa for the working mothers po natin.
Ma'am, ito po, ano yung most important call to action natin from the DOH for every residents here or every families to improve their nutritional well-being? And where can they find more information or more official DOH information po and assistance?
So simple lang naman ang gusto po natin, no. Start at home, choose nutritious food. So magsisimula talaga sa ating mga tahanan, practice healthy habits, no, and seek guidance. Kung kulang po tayo sa impormasyon, no, hindi po natin makuha sa ating mga internet, we can go and visit to our nearest health centers, no. Good nutrition is not just about eating well. It's about investing in your family future, no. So what every family can do, first, prioritize the first 1,000 days. We want to ensure that proper nutrition for pregnant, ang ating mga buntis, ang ating mga infants until yung mga kabataan po natin na umabot po ng 2 taon. Second, practice exclusive breastfeeding. So mga nanay dyan, mga bagong panganak, sa mga buntis, no? O nagpaplano pa lang, please, no? We want to advocate and we promote exclusive breastfeeding from 0 to 6 months. We want to continue safe, appropriate, complementary feeding also from 6 to 23 months and continued breastfeeding. Pangatlo po, we want to emphasize yung paggamit po natin ng Pinggang Pinoy, no? Follow the Pinggang Pinoy guide. Serve balanced meal using affordable, local, and seasonal food. Pang-apat, grow your own food. Yun, magtanim po tayo. Start a small backyard or container garden to supplement meal sustainability. So kung meron tayong backyard gardening, no, hindi na tayo pupunta pa o bibili pa sa labas, no. Very accessible po ito. Pang-lima, we want to drink clean and safe water, no. Boil or buy from accredited source to prevent illness and hindi po tayo magkasakit because of uncleaned water. Huli po, visit your local health centers, no? Kasi through our local health center, we can avail correct information, and we could also avail other services like micronutrient supplementation, vitamin A, sa mga buntis, yung iron with folic acid. We could also have nutrition screening and counseling. So marami pong pwede pong maitulong ang ating health facility.
Okay, so with that po ma'am, ngayon pong Nutrition Month, no, celebration ngayong buwan ng July. Ano po yung ating mensahe sa lahat po ng mga manonood natin, sa lahat ng mga mommies, parents, children, para po magpatuloy no yung ating programa and advocacy on nutrition?
As we close this timely and meaningful discussion in observance of the National Nutrition Month, we are reminded that nutrition is more than just a food on the table. It is the foundation of a healthy, resilient, and empowered nation. So on behalf po, Mamay, of our Regional Director, Dr. Lenny Joy Johnson Rivera, we extend our deep appreciation to our partners in nutrition who work hard and hand in hand to deliver life-saving intervention, especially for the most vulnerable group, our pregnant women, infants, young children, and underserved household. We also thank PIA, especially RD Noemi Adaga, Ma'am Myra Espinosa, and the whole staff behind the camera for inviting us and constant partner in information dissemination. So we encourage, the Department of Health encourage every Zamboangueño family to make nutrition as a priority. Not just this July, but every single day, visit your local health centers, support community gardens, teach your children the value of healthy eating. So together po, let us build a healthier, stronger, and more inclusive Zamboanga Peninsula where no one is left behind and every life is valued. Dahil sa bagong Pilipinas, bawat buhay mahalaga.
Maraming salamat po sa ating panauhin ngayong araw from the Department of Health. Thank you, ma'am. And very very timely nga po talaga yung ating discussion ngayon dahil nga we are celebrating Nutrition Month and very useful po talaga sa lahat po ng ating mga viewers because we would like really ina-advocate talaga natin yung proper nutrition sa lahat po. Hindi lamang sa buong Region 9 but for the entire Philippines. Thank you very much once again sa ating panauhin. We have Ma'am Crystal Intal de la Serna, the nutritionist and dietitian of the Department of Health in Region 9. Together with her po, yung buong team din ng ating HEPO and nating mga health and promotion natin sa Department of Health. Maraming salamat. And of course, we would like to greet din yung ating Regional Director ng DOH. We have Ma'am Doc Lenny Rivera. Thank you very much po sa pagpapaunlak sa aming invitation po ngayon sa ating programa. Once again, maraming salamat po. And thank you sa lahat ng ating mga viewers. Thank you rin sa buong team ng PIA for making this episode possible. Thank you very much sa lahat po nating mga following sponsors. We have Dunkin, Karimadon, Camiseta, and Penguin, all available here at SM City Mindpro. Sa ngalan pong muli ng aming PIA Director General Catherine Chloe De Castro and PIA Regional Director Miss Noemi Adaga, ito si Myra Espinosa and we will see each other pa po sa ating mga next episodes pa ng PIA Kapihan na Zamboanga sa SM City Mindpro. Muchísimas gracias.
Philippine Information Agency, Kapihan na Zamboanga. Sharing with you timely, accurate, and relevant information regarding government programs, projects, and activities. Catch us every Thursday at 4 p.m. on eMedia.